Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Dr. Jumana Karasne, and I will be with you for the coming few weeks in this course to discuss with you several topics. The first one, which is a very important topic, which is pain, the main cause why many patients come to see us in the dental clinic. And also I'm going to talk to you about cranial nerve testing, using of analgesics and antibiotics in the dental practice. So for the coming first 3 lectures, our topic is going to be about pain. The objectives that I'm aiming to cover during the coming 2 lectures is the definition and classification of pain, nociceptive pain, which is type of pain, pulpal pain, which is a subcategory of the nociceptive pain, and the possible pulpal diagnoses and possible periapical diagnoses. During this lecture, I'm going to cover the first 3 topics or 3 objectives, and I will leave the remaining 2 for the coming lectures. This lecture and most of my lectures will be divided into parts. At the end of each part, there is a couple of questions, maybe 1 or 2 questions regarding the part that I have just presented to you. And when you are able to answer these questions, then you can move to the second part. You can stop the recording, or you can stop listening to the lecture anytime and refer back to Google to look at certain terms or looking at certain definitions, so you can keep up understanding and following my lectures. So starting with the first part, talking about the definition of pain. Pain is an unpleasant sensory and emotional experience. So it's not just limited to a sensory, it is also an emotional experience associated with either actual or potential tissue damage, or described in terms of such damage. This is how the International Society of Pain defined pain. Very important features that we need to talk about. So first of all, if it is unpleasant, it is pain. So not all patients will come to you complaining specifically about pain or stating the word pain, that it is painful. Some patients would refer to what they feel as uncomfortable or annoying or irritating sensation. So as long as it is unpleasant, it is defined in terms of pain. It might not be related to an actual damage, a damage that you can see either as, for example, cavitated tooth or a cut in the skin. It might be a potential damage. So this broadened the concept of pain. Usually, and which is the main problem in our part of the world, is limiting the pain experience to the actual damage seen by the doctor or by the dentist. If you do not see it, if you do not see the damage, then there is no pain. This is a big mistake. We are, just limiting all the painful experiences to the humanity to only one type of pain, which is a nociceptive pain, or pain related to actual trauma or injury. There are different types of pain where there are changes that the doctor cannot see and cannot recognize. In the following or in the coming few lectures, hopefully this would be clearer to your imagination. You can now appreciate more the complexity of diagnosing pain and dealing with patient who is complaining of pain. Okay, there are specialized receptors that can detect these changes and can be transferred to the brain as pain. We call these free nerve endings. We have different receptors, either to detect thermal stimuli or to detect proprioception that is related to pressure, but there are specific types of nerve endings or nerve receptors, we call them free nerve endings, and they are specialized to transmit the signals of pain. Pain is modified centrally by cultural and psychological factors. So, you might have exactly the same stimulus or a painful stimulus, but this would be perceived and taken or understood by the patients differently. So some patients will consider this as an extremely painful experience. Others will consider this sort of irritating. Others would, think that it is not a big deal. So there are different factors. Some of them are related to the person himself, his threshold of pain. Other factors including his, for example, cultural. So usually men they do not express pain as frequently as females because it is not accepted to be seen as being in pain when you are a male patient, while this is normal for the female patients. And psychological factors, when you are stressed out, when you are under extreme pressure, your tolerance of pain is very much reduced. So certain stimuli that you can put up with in certain situations, when you are in or under extreme pressure, you cannot tolerate it. So pain is something variable that changes with time, changes with your age, changes based on the situation that you receive the pain. So for example, if we consider the soldier in a battlefield, he might have his arm amputated, but he will still be fighting, he will still be running, because he has to do so to survive, for example. So there are certain situations that this soldier has been put on, and certain modifications made him able to tolerate this sort of pain. While if in normal conditions, if he's at home, for example, this pain is intolerable. So pain is sort of a dynamic thing that is affected with the situation you are in, with your mood, with your psychological status. So this is important thing for you to recognize, because some patients will come to you complaining of a massive pain, intolerable pain. The patient could not sleep for so many nights because of pain. And when you examine the tooth, there is just a simple callous lesion. It doesn't make sense that only this simple callous lesion induced that much of pain. But the patient is expressing to you her experience with pain, and maybe she's under several stresses. Maybe it's the examination period, and she is under extreme stress, so this minimal pain was for her so irritating, so annoying, and so painful. So these are the things that we need to consider when we are talking about pain. Based on the origin of pain can be classified into either nociceptive pain or neuropathic pain. Nociceptive, this term means there is a trauma, there is a damage, which can be mechanical, like cut in the skin, or thermal, like burn, for example, or chemical, like using certain chemicals or acids that would irritate and induce chemical irritation. So all of these are called nociceptive pain. And on the other hand, neuropathic pain, there is no actual damage to the tissues that you see, but there are certain problems or abnormalities either in the peripheral nervous system or in the central nervous system. So this is the difference between nociceptive pain and neuropathic pain. Of course, nociceptive pain is far much more common than neuropathic pain, and this is why most of lectures or when anyone is talking about pain, he is actually referring to nociceptive pain. But recently, we became more aware about the neuropathic pain because we are seeing more and more patients complaining of certain types of pain that we are not used to see before, or we were not able to recognize before, which is a neuropathic pain. Based on the clinical presentation, how the pain is presented to you as a dentist, nociceptive pain can be classified as superficial pain or deep pain. The superficial, that the patient feels on the surface. For example, if you have a scratch in the skin, so this is sort of a superficial pain, because you feel it like you can specify the location and you can feel it like on the surface. For example, if you burned your tongue while eating hot food, or for example burned your palate while drinking hot tea. So this is part of superficial pain. You can specify the site of the lesion. It's sort of a burning, stimulating pain. The deep pain is something you feel that it is so deep inside. Like for example, when you have a headache. So the headache, it's not something on the surface, it is something deep inside that you feel. And the same applies, for example, muscle pain, joint pain. These are sort of a deep pain. So this is how we classify the nociceptive pain based on the where the patient feels the pain. Is it superficial or is it deep? This is very important to ask the patient about because it helps you to make a diagnosis. For example, dental pain is sort of a deep pain, pulpal pain, or periapical lesion. These are sort of a deep pain, while for example dentinal sensitivity is sort of superficial pain. The patient feel it like just on the surface of the tooth. Neuropathic pain also can be classified based on the way it is presented by the patient. So the patient might complain to you of pain that is sort of like electric shock pain. So this is intermittent pain that happens like a one single shot and then it disappears. We call this episodic. And there's another type of neuropathic pain which is continuous pain, that the pain lasts for long duration. It keeps going on and on and on. So this is continuous sort of neuropathic pain. Okay, another way to classify pain is the duration, how long the pain has been there. So we can classify the pain into either chronic pain or acute pain. Maybe this is more straightforward. So in acute pain, the pain is present at the site of injury, at the time of injury, and while this injured site is going into healing process. So this is an acute injury, and this is the pain caused by this acute injury. Let me change this first, okay? And the pain induced by acute injury is acute pain. Symptoms are usually severe and the pain is usually sharp. On the other hand, if we looked at the chronic pain usually it lasts for long duration, way beyond the time that the injury has took place. The symptoms are usually less severe and sometimes it is completely painless, where you take a radiograph for the patient, you notice the periapical lesion, but the tooth is completely asymptomatic. So this indicates the presence of a lesion there, and this problem took place maybe several months or maybe years ago. It is still present and it is completely asymptomatic, or maybe moderately or slightly symptomatic. So this is a type of chronic pain, and usually when the pain, or if the pain is present, usually it's sort of a dull aching pain rather than sharp stimulating pain. So these are the concepts that we need to understand and be completely aware of when we are talking about pain. The classification based on the origin, the nociceptive and neuropathic pain, and the classification based on the duration, whether we are talking about chronic condition or acute condition. This massive, huge slide you are seeing here is just to give you an idea or an overview about the complexity of pain, and we are here talking about the facial pain. We are just referring to the pain located in the face, in the head and neck area, which is actually the main specialty in dentistry. We stated that there is a sort of nociceptive pain, or we call it somatic pain, because it is induced by trauma or damage to the tissues, or neuropathic pain. And somatic pain can be classified into superficial or deep pain. And then deep pain, it includes the visceral pain and musculoskeletal pain. Among the visceral pain is the pulpal pain, which is the main topic of the coming 2 lectures, this lecture and the one after, which is the pulpal pain. Notice that we have different types of pain. This is the neuropathic pain, episodic and continuous pain, and all of these that I've just mentioned to you lie within the axis 1 pain. There is axis 2, which is psychological conditions. So some of the psychological conditions, other than the mood disorders, the anxiety and depression disorders, there are somatoform disorders. And in these disorders, the patient is presented to you, come to you to the clinic complaining of pain, probably a dental pain, and you do not find any evidence, any objective evidence of presence of a dental pathology. So this is why it is important you recognize the different types of pain so you can make your diagnosis and you can conduct the correct treatment. So you would be able to recognize that there are certain conditions that are not related to the dental pathology, are not caused by dental problem. It is mainly induced by psychological conditions. Also, you need to be aware of that there are different sources of pain other than the dental pain that might be presented as a dental pain and might affect the facial area, and the patient come to you complaining of a pain, and you need to figure out whether this pain is dental in origin, so you go ahead and do the dental treatment, or maybe not dental in origin and refer the patient accordingly. This complicated slide would be helpful for you to make a map, a mind map of the pain, to keep things in the back of your mind that it might not be a dental pain. Always think that it might not be a dental pain. Look for evidence of a dental pathology, go ahead and treat it, and if you did not find any evidence, think what it might be and where you need to refer your patient. So at your own time, go ahead and have a detailed look on that slide. You will find some conditions that you have you have dealt with, or maybe you have discussed in different topics in dentistry. We will keep coming back to this slide maybe in the coming few lectures to discuss different types and different sources of pain that might affect the facial structures. So what I want you to do is to think outside of the box. If the patient came to you as a dentist, this doesn't mean that he's complaining from a dental pain. Well, let's say 90% of the patients will be complaining of a dental pain, but in case where things did not follow the typical presentation of a dental pain or a dental pathology, when you did not find any objective evidence of a dental pathology, go out of this dental box and think of different causes or possibilities of pain. So this is the aim of the coming few lectures. So if this is sort of a simpler slide or simple, more simple way to present the previous slide about the facial pain. So it might be dentoalveolar, It might be, the source could be in the soft tissue, it could be the musculoskeletal, or could be neuropathic or neurovascular. We will keep these two, the neuropathic and neurovascular headache, to the third lecture. We will talk about them, give a few examples, and state why it would be important for you to recognize these conditions. In this lecture, we will mainly talk about dentoalveolar source of pain, and we will be talking about odontogenic pain, which is part of the nociceptive pain. And the second lecture, we will talk about other sources of pain that affect the face, including the soft tissues and the musculoskeletal pain. So by that, we will come to the end of part 1, and we'll see you in the second part, talking about nociceptive pain.